You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. We're talking about dental implants today. And with us, we have an expert on the topic, Dr. Samuel Sauza. Dr. Sauza, welcome to the program.
Hey, thank you for having me again.
Now, for people that don't know your practice, like who's the typical dental implant patient that you see?
So the classic patient that comes into our office is the one that really had really bad teeth their entire life, and they've been trying to get it fixed and be told by several different dentists, hey, you need to go into a denture now, and they're really not wanting a denture.
That's why they go to you, because they don't want a denture.
They don't want it.
Okay.
They come in and they're saying, you know what, my teeth are really hurting. Can you fix them? I've heard from other doctors that they can't be fixed. They've told me I need a denture. What can you do, Dr. Sauza? And that's what I'm here for. Second group of patients that we see in the office are patients that have had dentures for a long time. But this is kind of a rare one to walk into our office because a lot of times they just avoid the dentist at all costs. They've gotten their teeth removed. They feel like they don't have any worries in the world, and they're living with this hunk of plastic in their mouth that really just doesn't do what the natural teeth are supposed to do. And for those people, you know, we can give them upper and lower teeth that don't come out anymore. So, you know, the dentures don't really chew. So
it's hard to chew. Because I know a couple denture wearers. They never complain.
Oh, well, they don't complain to you, but we see them in the office, and sure enough, they're wanting us to reline, adjust, and they're just never quite getting what they're looking for.
Okay, good. Now, I know your age. You look younger than you are. But you have a lot of experience. I mean, you went through a special program.
That's right.
Like a 3-year specialty program at Loma Linda University.
Yes.
For just implants.
Full-time residency. So it's not like a continued education course or a weekend situation where you're just learning a few new things. It's a full-on, fully involved course where curriculum where you're working with some of the best in the industry. So the wonderful thing about this residency program, full-time residency program, is that we get to see patients that have had these treatments done and that have been with their functional teeth for 10, 20, 30 years. So we get to see the full range of the long-term outcomes of how these things age over time. And that's very critical knowledge to have when you're working.
So they can last like 20 years.
Oh yeah, as long as you're alive and working.
They can go. How old can you be to get this done?
Oh, well, Randy, let's see. Let's say the oldest patient I've seen in my practice at least has been 94 years old. They got a full set of upper and lower teeth, but they were running around. They were having a great time with these things.
Why would a 90-year-old want to do this?
Well, because they're alive. They got to eat. They got to go and smile at their grandkids. You know, they got lots of things to look forward to, and it's kind of hard to do when you're worrying about your teeth falling out of your face.
Now, you've been a dentist since you were about 10 years old, in your mind.
In my mind, yes.
Because your father and your mother are dentists in San Diego, California.
Yeah, they definitely groomed me into this profession, that's for sure.
How has that helped you with what you're doing today?
Well, I've gotten to see the profession really evolve over the years, you know, where my dad used to do a root canal here, a crown there, and, you know, do some patchwork to really fix a couple things for a patient. We're able to change a patient's entire smile now in 1-2 visits, really. And that's really changes the game for a lot of people.
And we've talked in the green room, we've even talked on the phone, but you said that like it's almost like the third set of teeth, dental implants, where your baby teeth, and then you get your adult teeth, and if you lose those, now you get your teeth again with implants. Is that an overstatement, or is that kind of how it is?
With what we're doing nowadays, it's a very real statement to say.
Okay. Now, are there a lot of people like in Modesto or in your area that are either headed to dentures or have a denture? I mean, is it a big problem?
Oh boy, if I were to line up with the people that were needing this sort of work from in a straight line, you'd have a line from Los Angeles all the way to San Francisco.
So there's a lot
because there's a lot of people that need this, absolutely.
So would you say there's like tens of thousands of people within an hour, 2 hours of your practice
that have
an upper or lower denture?
Yeah, absolutely. Upper or lower denture or something in between that's not quite doing it for them.
Do you think the future of dentistry will be like in 20 years, 30 years, the dentures as we know them today won't exist?
I think dentures are on their way of being obsolete. And I mean, the reality is, again, we're putting these hunks of plastic in patients' mouths. They're medieval.
Okay. So just everything will be attached to like maybe implants.
Everything should be attached. If you want to be able to smile, eat, chew, go about life comfortably, you can't have things floating in your mouth.
Okay. Now you said that there was a 90-something-year-old that you gave upper and lower teeth, new teeth that didn't come out.
That's right.
What can they eat?
What can they not eat is a question with these things.
Okay.
This particular patient had been in dentures for, I think, a good 20 years. He had gone into snap-on dentures, wasn't happy with that, because it's the snap-on denture still moves around every time you chew a little bit. So he wanted something more permanent, so he came into us and we placed a few more implants. With as little as 4, sometimes that'll get you to the finish line. And now with a set of teeth that are attached to his
so they don't come
jaws,
out.
they don't come out. He's able to chew. He's eating popcorn now. He's eating his apples, cereal, whatever he wants to eat. Those are terrible things to bring up as as examples, but the steaks are there. The lasagna. Whatever.
So they're back. They're eating again.
They're back to chewing. They're back to their old selves. And the beautiful thing is you see these patients and they look at you and they say, Doc, I feel like I'm 50 again,
Okay.
Which is, to put it into perspective, that's the last time he had functional teeth in his mouth.
You say they all have a regret of not doing it earlier.
That is oftentimes the sentiment, yes. They'll say, if I think if I would have done this 10, 20 years ago, I'd be a little healthier. I'd be eating things that, that would be better for my overall health than what I have been eating, which is what my denture allows me to eat, which is crazy.
Okay.
It's crazy that we let a little piece of plastic dictate what we can and can't eat.
Now, what about people with bad gums, like gum disease? Mm-hmm. Could they do this procedure? Or their implants, are more likely to fall out if you had gum disease? Their gums are too bad?
Oh, well, patients with bad gums, that's one of the main sets of people that we see.
Okay.
For example, I had a patient, he was a lawyer. So, throughout his entire career, he's smoking cigars, he's, just doing his lawyer stuff, not really focusing on his teeth. Comes in, teeth are falling out, there's no bone supporting the teeth anymore. And he doesn't want to wear a denture, he's a lawyer, he's got high sophisticated friends.
Okay.
We clean everything out. We take out all the diseased gum tissue, give you a fresh new start, place our implants, and just like that, he's got his healthy, natural smile again that he had when he was in his early 20s.
Now you say this is changes people's lives, getting their teeth back. Really?
Gives patients a brand new start. Can you imagine biting into any of your favorite foods in the world and feeling pain, feeling discomfort, feeling like something's gonna fall out? You can't do it. You're gonna live with this cloud over your head that is gonna constantly rain on your parade, right? So by giving patients something that's permanently attached to their mouths, their fears, their concerns, their worries, it's gone. And that is what makes this procedure life-changing. Now,
Medicare, Medicaid, even the best insurance only covers a very small portion. But you say people are financing this. Is that right?
Every day, yes. We have a team of special staff there at the office. That's all they do. Get the ins and outs of your insurance, milk every last penny out of that, and then find ways to make this as affordable to everyone as possible.
Okay, now you're centered. Mm-hmm. I guess how dental, correct me if I'm wrong too, by the way.
Okay.
The way implants are typically done is you go to one place that does a surgery,
mm-hmm.
you go to another place where they put the teeth on top, and then maybe even maintain them elsewhere. You do it all right there. Is that why you're able to do it so fast?
That's exactly right. You get one doctor who does everything from start to finish, and that's what makes us a very special situation. Because growing up with my father, again, general dentist, great practice, but he only does general dentistry. So if you needed something a little more advanced done, you're going to one specialist, another specialist, and back to him to install the teeth. It can be an entire circus sometimes.
Okay.
So by having everything in-house, you're only dealing with one person. Makes it a lot easier to kind of know what's going on, to know what to expect, and for us to give you just a very well-groomed service.
So you do the surgical part, and then you also put the teeth on top.
That's correct, yes.
And it's not always done that way. Is that correct?
Not always. A lot of practitioners, a lot of doctors out there like to stick to their specific thing.
Okay.
And again, being an oral implantologist, I get to do everything start to finish. So it just really changes the game up for the patient experience and for what we're able to do in a timely manner in office.
What do the patients like the most? Do they like the way it looks or what they could eat?
Oh, this is a fun question because I get patients all the time that tell me, I don't care how it looks, I just want to be able to eat. And then on the other side, I get patients that tell me, I want things to look pretty, I don't care what I'm eating, I'll eat mashed potatoes for the rest of my life, right? And these patients, once you're done, the ones that are able to eat well, thing they love the most is how great it looks. And the patients that wanted to have the, the pretty aesthetics and everything, they have that. But they're commenting on how they're able to grind through an entire set of McRibs at, at their favorite restaurant.
Ribs, everything. I mean,
They get
what about
through it,
like a raw carrot with their front teeth? Is that not recommended?
With the newer materials that we're using nowadays, raw carrots, no problem.
So salad. I mean, what do they like? They like salad. I guess denture wearers can't eat salads.
Can't eat salads. They can't eat anything that has any sort of real consistency to it. If it's delicious to you, denture wearer probably won't be able to get through it very well. So yeah, these patients, once we're able to install these teeth in them, they are rocking and rolling out there with these. So a lot of these patients, once you're done with everything, install these beautiful porcelain teeth, they're nervous. They really are nervous. They tell me like, are you sure I can bite into this? We had a patient, he had not bitten into an apple since he was 22 years old. And he made that a very clear point when we started the whole process. He's like, I just want to bite into an apple. And when we installed everything, he's like, are you sure? Like, I've had this before. I've had doctors tell me, bite into this, and out goes the denture, out goes, the bridge that they installed. So we had him in our office. We had a little tray with some apples in front of him, and he took a bite, and he just lit up. So yeah, we really are able to give patients back what they looked for.
And you say now they're starting to take selfies, posting them?
with the way the internet is nowadays, yeah. They're really sharing some of the best advertising and thing out there is the after effects of these patients.
Now, when it's all done, right, you say their personality changes. Like sometimes you don't even recognize them. Like, how you initially met them and what happens after they get their teeth back. Elaborate on that.
So like in a nip-tuck world where everyone wants to facelift that or filler this, really nothing gives you your soul back the way fixing your smile, having a healthy looking smile does. That just makes patients really light up in a way that all the other cosmetic work I've seen out there just doesn't quite get you there. We get patients that have been through that. They've gotten all these cosmetic surgeries before, and they're like, I'm just not getting the effect that we're looking for. And this particular lady, and it's like, okay, well, let's do your teeth next, okay? She had all those sorts of gum disease, all sorts of broken down teeth that would have been an absolute nightmare to try to restore the traditional way. And we, again, removed everything, placed our brand new set of teeth in her, and that was the drop that overspilled the cup there.
Now you can do this in like as little. I mean, of course, everything has to work out right, but like somebody watching this, with as little as 3 appointments, they could have their new teeth, upper and lower. Is that true?
That is correct, yes. As little as 3 appointments, with one of those being a consultation where we're just kind of talking, getting to know each other. Because that's important. I like to know the patient, the person on the other side of the chair there.
And then the second appointment is what?
Second appointment, we're collecting what we call records, taking photos, we're making digital files, models of your teeth, the way everything looks right now, and designing everything for what we want things to look like the day of the surgery. So third time you come in, we do the surgery, and you leave with that which we designed on day one.
How soon can they eat after you actually give them their new teeth?
Well, they can eat immediately. They have to take it a little easy. We're looking
like softer foods at the beginning.
Yeah, some soft ravioli, of course the mashed potatoes, applesauce, really soft things. You're recovering from a surgery, right? But yes, you're able to eat things immediately after the procedure, and as the weeks go by, the types of food that you're able to get through just gets progressively better and better.
What about nuts?
Nuts?
Would you eat nuts, or you got to be careful with nuts?
Once we're all set and done with everything, you will be able to eat nuts, absolutely.
Chewy things like popcorn?
Popcorn is popcorn's hard for me, and I have all natural teeth, But popcorn, no problem. Again, you can go down the list of ingredients, and with what we're able to do with implants today, there isn't a thing on that list that you wouldn't be able to get through.
We're going to take a quick break. We come back. More about the implant process, what people can expect on day one. You're watching the Wellness Hour, news that makes you healthier. We'll be right back.
I had dental implants at Sierra Dental Care. I got this procedure because I've had poor teeth for a number of years. I finally came to the point in my life where I had to get dentures. And when I got dentures, it severely limited what I could eat. And once that happened, I thought, I've got to do something different. And that's when I started to pursue getting implants. I could not bite into an apple. I could not eat corn on the cob. I pretty much had to cut anything up very, very small if I was going to eat. I was just severely limited on the types of food I could eat. Actually, this had health implications on my life because I couldn't even enjoy a good salad. I looked at a number of different dental clinics, and I decided to go with Sierra Dental Care because I found them to be the most competent, and I had the most confidence in them after I interviewed them.
Click on SierraDentalCare.com.
I had dental implants at Sierra Dental Care. The first thing I could say when I saw my new smile was, wow. All of a sudden, I had a renewed confidence in my smile, in my life, in my total self-being. I believe I'm healthier now because of the implant surgery, because I'm able to eat good, healthy foods, and I'm pretty much able to eat anything I want. The first meal I ate was a steak. I would recommend dental implants because it gives you a new confidence and self-esteem. My life has been changed since I had the dental implants. And if anybody has missing teeth or just has poor dental health, dental implants is the way to go. Dr. Sauza, in my opinion, is the best dentist I've ever met. My experience with Sierra Dental Care has been wonderful, and I would recommend it to anybody who has dental problems, missing teeth, and needs that new lease in life when they get implants.
Click on SierraDentalCare.com.
You're watching the Wellness Hour news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. My first guest says nobody should be wearing a loose-fitting denture. With us we have implantologist, general dentist, Dr. Sauza. Dr. Sauza, welcome back to the program.
How you doing?
So the two categories, the people with really, really bad teeth that you can't save, and their only option they think is a denture, or the denture wearers. When they go to your practice, what are their options when it comes to dental implants?
So typically we offer these patients two main options. One is a set of teeth that snap in and out. So a lot of patients, especially in other centers, like to go this route because it tends to be a little more economical. But what they don't tell you is that this set of teeth is truly still a set of dentures.
Like how many implants usually for a snap in, snap out teeth?
It's in between 2 and 4.
Okay.
And again, the key point here is that this is still a denture. There's still a lot of plastic that has to cover the gums, that has to cover the roof of your mouth. And even though the snap in, snap out feature is great, if you chew hard enough on anything, it can sometimes snap out while you're eating, and that can be very troublesome for a lot of patients.
You're not a fan of this?
Not a fan at all. So,
But it's going on all over the country.
It happens a lot, and we
You
see
said
a lot
the newer guys do it this way.
a lot of guys do it this way.
Okay.
And if I'm honest, a lot of the patients that we see in the office are the ones wanting to do something better.
Okay.
So that's what leads me to the second option, which is a set of teeth that are actually permanently attached to the implants that we place. So this typically requires anywhere between 4 to 6 implants in the more complicated of situations. And again, this is what really, I think, transforms people's lives.
Now that upper denture though is pretty good. It's got like a little bit of suction because of the roof of the mouth.
That is in the most ideal of scenarios, but the reality is the suction goes away after the gums change over the years. And what a lot of these patients are finding is that they're having to put in this powder or sticky stuff that'll hold the denture to the roof of their mouth, and it is an absolute mess to live with. So, well, Randy, it sounds like you've never actually had to wear a set of these dentures.
Okay, right.
One of the funny exercises back in residency, what we did, we actually grabbed some of this denture adhesive, and our clinical instructors had us coat the roof of our mouths with this denture adhesive, just so we understood what that felt like. And if you've ever chewed gum for too long and it just gets all sticky and gross and everywhere, that's what that felt like. It was just having gunk in your mouth.
Okay.
Throughout the whole day. It doesn't go away, by the way. It stays there for hours. So you really don't get relief with a set of dentures. You don't catch a break at all.
So with the implants on the upper, it's like 5 or 6 implants on the upper, full arch of teeth, the palate is no longer covered.
No longer covered. With a set of implants and teeth that are attached to those implants permanently, you are essentially replacing a complete row of teeth. You don't have anything on the roof of your mouth. It's as close to nature as we can get.
Now what about pain? I'm sure they're always asking about this on the consultation.
Absolutely,
What
yes.
about pain?
Well, the reality is real pain is having to live with something that you're not comfortable with every day of your life. And that's what life is like for a lot of our patients when
They have bad teeth.
they have bad teeth. So let's say they have the procedure. 80% of the patients that we see in office, we're able to do it so comfortably, they don't even need anesthesia. They don't need to be put under.
Like what? Just numb?
We just numb up the areas that we're working in, and we're able to work with them simply as that. You know, not having even to, again, some patients are a little anxious about anesthesia. They don't want to be put under. No problem. We're able to do that for them comfortably. Now, for the patients that are a little more anxious, or they just don't want to know what's going on, they just want to wake up with a new set of teeth, we have those options as well, where we can bring in anesthesiologists that'll, fully
like
sedate
IV
you.
sedation?
IV sedation, general anesthesia. We have all the different levels to make sure we fit your comfort level desires.
And now, when things go right, do you give them medication for the next day, the day after? Do they complain a lot about pain? What's that like?
So typically the first 3 to 5 days, you're on some sort of painkiller, pretty standard for any surgical procedure. And most patients tell us after day 3, 4, they're not even taking any more of the pain drugs.
Is it true that some patients don't even take pain medications?
A fair amount do. We actually had a situation where one of our patients, we called for the 2-day post-op, 3-day post-op. He doesn't answer. 1 week post-op. Where is this guy? Did we lose him? We're getting a little concerned, right?
Okay.
We get a call back about 2 weeks later. He went on a backpacking trip in Utah, just out in the countryside with some of his buddies. Like, nothing ever happened. We're like, are you kidding me? Like, you're supposed to be taking antibiotics. We're supposed to be following up with you. It's like, oh no, everything's been fine. I've been eating my,
That's nice.
my packaged granola. He's been good. So again, we can do this very comfortably for a lot of patients.
Is this one of those things where like spouses do it together? Like husband and wife, or maybe on an occasion, getting married, getting divorced, whatever?
Oh, I think we've seen a fair amount of patients where, let's say they've been together with somebody, they're tired of hiding, their removable partial or their complete denture from this person they've been together with some time. They get the procedure done. Next thing we know, they're engaged and getting married a few months after.
Is that right?
So that's a very typical pattern for a lot of patients.
Now you're a dentist. And we're short on time, but you probably think that the smile is like one of the most important things.
No, it's not that I think it. It's literally what patients are asking for.
Okay.
Because they know a smile is what ignites romance.
Okay.
It's what, lights up your face when you walk into the room. It's what creates opportunity for people.
Okay.
A smile is the first step to that. And, think of yourself going into a job interview. What kind of personality you're going to portray to the person interviewing you if you're hiding your teeth, you're,
That's a good point.
trying to hide behind something. That is just not the way to be able to.
And people with bad teeth, like we talked about this, like in the movies. Mm-hmm. Like every director in Hollywood knows if you want to make somebody look poor or not very smart, you remove their front tooth or you give them bad teeth. So, in fact, I've had dentists on the show that they make these bad teeth for Hollywood, right? So, but you say a lot of these people with really bad teeth are brushing and flossing, but they have a bacterial infection. Like there's nothing they could do about it. When they let it get too far.
That's correct. There's a point where things just get a little too far gone, and you can do all you want to try to save a tooth, but sometimes that's just not going to happen.
We're going to take another break. We come back. Your final message is somebody with really bad teeth or a loose-fitting denture. You're watching the Wellness Hour, news that makes you healthier. We'll be right back.
I had dental implants at Sierra Dental Care. The first thing I could say when I saw my new smile was, wow.
All in 4 refers to the use of 4 dental implants. You get something that's a lot more functional and closer to the experience that you would have with natural teeth. What makes All in 4 great is before in the past, if you had infected, unfixable teeth, you were pretty much sentenced to a removable prosthetic that just never sat quite right in place and be pretty uncomfortable to live with.
All of a sudden, I had a renewed confidence in my smile, in my life.
It's a way of replacing someone's broken down and otherwise unfixable teeth.
I believe I'm healthier now because of the implant surgery. I decided to go with Sierra Dental Care because I found them to be the most competent.
We're down the street here in Modesto, and we've got lots of experience handling these type of cases. I like making people smile again. That's what it is.
Click on SierraDentalCare.com.
I think a very important part for any practitioner that's doing implants, to have like a really good, solid training. I got accepted into the Residency program for implant dentistry there. It's only about 3 or 4 of those in the country, just tailored to the implant surgeries and the prosthetics. All in 4 refers to the use of 4 dental implants. You get something that's a lot more functional and closer to the experience that you would have with natural teeth. What makes All-in work great is before in the past, if you had infected, unfixable teeth, you were pretty much sentenced to a removable prosthetic that just never sat quite right in place and be pretty uncomfortable to live with. It's a way of replacing someone's broken down and otherwise unfixable teeth. We're down the street here in Modesto, and we've got lots of experience handling these type of cases. I like making people smile again. That's what it is.
Click on SierraDentalCare.com.
You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. With us, we have an expert on the topic. He says nobody should be wearing a loose-fitting denture. Dr. Sauza says that if you've been told you don't have enough bone to get a dental implants, think again. You need a second opinion here. And you can actually get, in as little as 3 appointments, get a brand new upper and lower set of teeth that don't come out. Dr. Sauza, welcome back. All that's
Thank
true?
you.
What I just said?
Absolutely true, yes.
Not an exaggeration?
Not an exaggeration. Gone are the days where we couldn't find bone to place implants. Really, nowadays it comes down to experience, technique, and really, again, if a patient comes in with what they've been told, there is no bone, I have ways of finding it. So.
And this is because of what? Your Loma Linda training?
Very, very much so. Very much so. Again, when working with some of the, some other big experts in the field, you really get to see all the different options that are available to patients, and you get to learn them. And now we get to serve them to the people.
So no more dentures.
No more dentures. That's correct.
So what is your final message? Somebody watching this, they're the 2 groups. Really bad teeth. They know one thing, they don't want dentures. Or the denture wearers watching this, but they're still afraid or skeptical. What do you say to them?
I'd say come on in and get to know us a little bit. I think just being in the practice, walking through the options with us, you're going to find something that you're very comfortable with that will absolutely change your life. And I think that's what you need to remember if you remember anything from all of this. Okay,
good. And so if they want to go and make an appointment, do you prefer they go online or they just call the practice? Or both?
We offer both options, but sometimes it's nicer to talk to a friendly voice over the phone. So
in the process, everybody gets to see you if they're going to get the implants. Is that right?
That's correct, yes.
And you have a team of doctors, right?
We have a whole full team of doctors there to cater to every patient's needs. And if we're looking to do something where we're replacing all your teeth with implants, you're definitely going to see me there.
All right. I want to thank you for coming on the show. Good stuff.
Right, thank you, Randy.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.